Okay, so another thing that I wanted to talk about, which is on everybody's mind, is the academies and scripts. So everybody wants to know which academy is the best to go to for PLAB 2, which one will help them prepare the best and secure, at least a pass or secure very good marks if they're more confident. Uh, my advice regarding academies is it's really not that important which one you go to. You can just find out from friends or colleagues or anybody, or even go to Facebook and figure out from other people's reviews which academy might be best suited to you. But in the end, the important thing to remember is it doesn't matter which academy you go to, because they're all going to teach you the same thing. They're going to teach you the same way to prepare and everything. But after the academy, after you're done with that whole 2 week or whatever course, your preparation, your remaining preparation with your colleagues or friends with, who you're going to be practicing with, that is the most important thing, because that is going to be the main time you're going to be preparing for the exam. So just keep that in mind. The academy isn't as important as your practice afterwards. Regarding the scripts, the best thing I can tell you is just use these scripts as a guide. So most people, I wouldn't say most people, but at least some people use them as, like the holy book of trying to pass PLAB 2. If you use the scripts in that sense, rather than using them as just a rough guide of how to go about or approach a station, it can actually be quite detrimental to your practice and the actual exam. Now, there are a couple of reasons for this. The first one is that the exam these days is changing on a day-to-day basis, and even from a person-to-person basis. The exact same scenario that is written outside the cubicle, it could be totally different for you and for the very next person who's coming in. They could just tweak the scenario very slightly. So it doesn't matter whether you've studied from the script. If you just memorize it and go in there, they may give you something totally different. They may throw you a curveball and you may not be prepared for that, because in your mind you're only ready for what's there in the scripts. So like I said, it's very important to think of the scripts as just a rough guide to show you the approach to a station, rather than exactly how a station is going to go in the exam. Let me give you an example. All they would need to do is change one word in the exam scenario, and that could completely change the management. In the script, it would say that you're a doctor in the GP, but in the exam scenario, all they would have to do is change that from a doctor in the GP to a doctor in the A&E, or a ward doctor or something like that, and your management plan would completely change because of that. So that's just a small example of how important it is to just use the scripts as a guide rather than memorizing them and going in. For example, if you were to use the management that was mentioned in the script for somebody who is a doctor in the GP, it wouldn't work out as well, because you're trying to give the patient information as though you are an A&E doctor or a ward doctor. So giving that wrong information because you're scripted could actually lead to you getting lower marks, or could get you ticks in consultation and listening. The second reason it's better not to be scripted in the exam is that the examiners and the simulators are very, very well trained and aware that people are using academies and scripts to go about the exam now. So if somebody comes in scripted and they're using things like stock phrases and lines and just going by what they remember from the script, these simulators, they may tell you something totally different which you would not expect, and that might just completely throw you off in the station and you wouldn't know what to do. It could waste a lot of time. You could end up giving the wrong management or not asking the relevant history just because of that. Again, I'm going to just keep repeating the same thing because it's just that important. Use the scripts just as a guide. Do not be scripted in the exam. That is extremely important. Remember that, guys. Apart from that, another thing to remember, I mentioned this before, but it's still very important, is that they're not looking to find out how much theory knowledge you have. More experienced doctors who are maybe senior residents or consultants in their home countries, when they come to give the PLAB 2 exam, they may end up not doing so well because they try and show their extra knowledge and experience that they've gained over the years. And unfortunately, that's just not what they're looking for in this exam. They're just looking to see whether you will be a safe doctor at an FY2 level in the exam. And if you're going to go and take clinical decisions and give off information that's just way too high level and too complicated for the patient or the simulator to understand, then it's just not going to reflect very well on you in the exam. So keep that in mind too. Try and make things simple for them to understand. In my case, I never once mentioned the name of a medication throughout those 16 scenarios. except in the Simman station where it may be necessary to. But in every other station, no matter what it was, I didn't even mention the name of medication. I would just make it so that the patient understands what I'm going to try and do to help them. So if a patient were to come to me with a cough, it wouldn't be so important to tell them exactly which medication you're going to give them. All they need to know is that you're going to give them some medication for their cough so they'll feel a bit better, or if they come with a backache, you'll give them painkillers. Just that's the sort of information that they need to know. If they require more information, they will definitely ask you that. But that's not to say that you shouldn't give out more detailed information if it's helpful. So there's nothing wrong with telling the names of medications and things like that, but that could lead to the patients, the simulators asking you more questions about those when it's not really relevant to the exam scenario. So keep that in mind. It's totally up to you whether you want to get into slightly more detail or not, but all I'm saying is don't get too detailed, don't get too caught up in the theoretical aspect of the whole thing, because that's just going to throw off the whole station and it will end up wasting time as well. Since you only have 8 minutes, guys, you only have 8 minutes, so you have to use that time very, very carefully and keep everything you say relevant to the station and relevant to what the patient is asking you. Address their concerns. I hope that part was clear, because it is quite important to keep in mind to save time. Okay, so I know I've been telling you guys a lot about what you shouldn't be doing in the exam, but here are a couple of things that you can keep in mind that you should be doing, and if you follow these general rules, you should be, every single station should generally go well for you, unless they are something very specific. So the first thing to remember is take a very relevant and take a very accurate history. If you're not able to take a relevant and accurate history, you may end up wasting a lot of time asking questions that are not really necessary to the station. Right, so if somebody comes to you with a respiratory complaint and you start asking them neurological questions or questions about their abdomen and things like that, it's just going to end up wasting your time. It may seem like you're not very focused in your consultation too, so that might lose you some marks. And history taking is one point where people end up spending a lot more time than they actually need to. So generally a good rule of thumb is to just spend maybe 3 or 4 minutes on the history max, and then spend the rest of the time in the management, especially because management is the time where you get to display your interpersonal skills the most. When you're explaining things to the patient, handling their concerns right on the spot over there. So that's where you really get to show your empathy, your sympathy, and your interpersonal skills. So try and keep the history as relevant, accurate, but as brief as possible also, so you will be able to manage your time very well in the exam. The second thing I wanted to talk about is knowing what examinations and investigations are needed in that scenario. Now, this can only come with practice, and this is only going to come through, having an idea of what to expect in the exam. What that means is you need to go through the scripts and you need to do a lot of practicing, so you are already prepared for what might show up. In those 90 seconds before you go into the cubicle, you'll have time to think about what sort of history questions you need to ask, what sort of things you need to rule out, what examinations and investigations can help you confirm or at least get a good differential diagnosis so you can speak to the patient about it. So those 90 seconds are extremely valuable, and it'll help you think about what examinations and investigations you need to ask. Now I'm just gonna give you simple examples because it's just easier to understand that way. Like I said, if somebody comes to you with chest pain, you'll be checking their vitals, you'll be doing a general physical examination, you'd be checking doing a chest examination. And since it's mostly history taking stations, you won't actually have to examine unless it's a procedure or an examination station, but you would have to verbalize. You'd have to say that, okay, since you've come with chest pain, I'd just like to check your vitals, I'd like to do a general physical examination on you, and I'd also like to do an examination of your chest so we'd have a better idea of what's going on. And then most of the time they'll agree, unless there's some reason they don't want an examination done. Then you would move on to the investigations. So for example, if somebody comes with chest pain, to be a safe doctor, you would want to rule out things like MI. So you would ask for troponins, you would ask for an ECG, you would ask for some routine blood tests just to get a better idea of what's going on. You'd also want to do a chest x-ray to see if there's anything else that's underlying. So those are the sort of things you need to think about too. Right, so that's why examinations and investigations are also very important to think about before you actually enter the cubicle. The third thing is giving a management that's suited to the patient condition and giving a management that works in the right context. I'm going to use the MI example again, where if somebody comes to you with a heart attack, The first thing that should be on your mind is making sure they're safe and stable first of all before moving on to anything else. You'd be giving them painkillers, you'd be giving them oxygen, aspirin, and that sort of thing, so that they're stable, and you'd also be running investigations to that end. Now, while it's true that lifestyle changes are also very important to somebody who has had a heart attack, it's very important to put that into context. So for example, if somebody comes to you with a heart attack just an hour ago or an ongoing one, if you start talking to them about lifestyle changes like cutting down on smoking or cutting down on alcohol, it's going to be very, very irrelevant to the current situation, because you need to be more focused on keeping them stable and keeping them alive at that point. You can bring up the lifestyle stuff later on, maybe when they're getting discharged, or you could just mention it in passing. So once you've explained to them what their condition is, and once you've given them the symptomatic treatment and the actual life-saving treatment, once you've explained all that, then you can say, also maybe in a couple of days we can speak a little bit about your lifestyle so we can prevent this sort of thing from happening again. In most of these critical scenarios, doing that would be much more helpful than giving a long list of lifestyle changes that they need to make. So like I said, give a management that is very suited to what's going on with the patient, and give a management that's suited to your pay grade, to your level, at an FY2 level. Definitely do not speak for any senior doctor. Do not speak for consultants or anything, and don't say what the consultant is going to do for them. All you need to do is address their concerns and speak from your end what you're going to be able to do to help the patient, and what you're going to be able to do to address their concern. Okay, and the fourth and final thing, I've already mentioned this, but you should know what sort of red flags to look out for and what sort of safety netting to give. I gave the meningitis example earlier, but another very common one that could come up is in back pain. So if somebody comes to you with back pain, but they also have incontinence, if they have saddle paresthesia, then you could also be thinking of something like cauda equina, which is a medical emergency. These are the sort of things that you guys need to look out for in every station. If they give you red flag signs, an alarm bell should go off in your head, and you should definitely bring it up with the patient that something deeper might be going on here, and that you would like to escalate it to a senior or speak to your consultant about it so that they could take further steps that are necessary. Alright guys, so that's the end of this video on an introduction to PLAB 2. So if you guys found this video useful, then give it a big thumbs up and subscribe to this channel too, so you can keep up with future updates and resources. Also guys, I have a Telegram group that I'm going to put in the description below, so join that so you can keep up with the latest PLAB discussions. So my next video is going to be about a guide to history taking in PLAB 2. I'm going to go in depth about how you would take a history in any given scenario in the exam. Obviously, like I said, I'm not going to be talking about exact exam scenarios, but I will be outlining the general approach, and hopefully that'll be very useful to you guys in history taking, not just in the PLAB exam, but hopefully in your future endeavors as well in the NHS. If you guys have any ideas on future videos or any topics that you'd like me to discuss, then please leave a comment below. Alright, so we have come to the end of this video. I hope you guys found it useful. I hope all of you guys and your families are keeping safe during this pandemic. I know it's a really difficult time for everybody, and with a little bit of luck and determination, I know all of you are going to get through this exam. So good luck to everyone, and goodbye.